Picture this. It's 1962. Deep in the jungles of Vietnam, the United States military introduced a powerful weapon unlike any other. Rather than machine guns and tanks, the Americans brought in something completely new. A tactical herbicide was used for control of vegetation during the Vietnam War. Agent Orange swept through Vietnam like a tidal wave. It was used to destroy and reduce the value of crops, improve visibility, and eliminate any possible enemy cover in war. Agent Orange did more than just clear out trees, though. This highly destructive chemical has left behind a toxic legacy that is still present today, provoking irreversible damage to the environment and severely hurting both civilians and the military. Scary, isn't it? That's only a small glimpse of the destruction brought about by the use of chemicals in the Vietnam War. The U.S. had initially planned to weaken their enemy forces of the Viet Cong by destroying any sort of forest cover in North Vietnam and some parts of South Vietnam. So, enemy movements, ambush sites, and supply routes were exposed and more easily destroyed. Overall, it's been estimated that over 74 million liters of tactical herbicides were used in Vietnam during 1961 to 1971, 60% of which being Agent Orange. Yes, Agent Orange was highly effective in terms of the U.S.'s military mission, but at what cost? Agent Orange was sprayed at 20 times the recommended concentration, defoliating millions of acres of forest and farmlands, much of which is still degraded and not suitable for farming today, as well as releasing dioxin, a highly toxic chemical. Even in tiny amounts, this chemical can cause severe, long-lasting health and environmental issues. After being sprayed, the dioxin-laced droplets seeped deep into the soil, directly contaminating the land for years. As a result, both Vietnamese citizens and U.S. soldiers were exposed to chronic health risks, such as cancers, neurological diseases, and birth defects, as well as impacting surrounding areas and test sites with irreversible environmental damages. American soldiers had no idea what they'd signed up for. Initially, serving in the war was taken as a patriotic duty, especially within the context of fighting communism in the Cold War. However, as the war dragged on and U.S. soldiers started experiencing the physical and psychological effects of it, people began to question their initial enthusiasm. This was especially true when soldiers returned with severe illnesses and newly developed health issues. It wasn't until 1984 that the first significant piece of legislation regarding Agent Orange was passed, the Veterans Dioxin and Radiation Exposure Compensation Standards Act. This meant that veterans had to wait roughly a decade after being exposed to insane amounts of dioxin to receive compensation. However, the process of recognizing eligible diseases and providing compensation to those who need it continued for years after that. The fact that dioxin is still present in the environment today, over 60 years after its first use, means that generations of people continue to suffer its effects. Agent Orange wasn't an issue that was only present during the Vietnam War. Its consequences still haunt us today. The loss of biodiversity, soil degradation, water contamination, and the destruction of mangroves are all consequences of this excessive use of Agent Orange in Vietnam. However, this tactical herbicide did not solely affect Vietnam. The United States had conducted secret testing of this chemical in various different locations around the world, including Texas, Mississippi, Puerto Rico, Laos, and Canada. In 2018, Congress signed the Consolidated Appropriations Act, allocating funding for dioxin cleanup and health support in Vietnam, sending $20 million to environmental remediation in dioxin-contaminated sites and $10 million toward the health and disability programs in affected areas. This commitment is a significant step toward addressing Agent Orange's destructive impact, but transparency and accountability toward some of the remaining dioxin-contaminated test sites is still necessary in order to fully confront the herbicide's legacy.